Hello everyone, good morning. My name is Divyashri from Group 3 and I'm going to be discussing about post-operative care for patient who has undergone elective neck lipoma surgery. So what is lipoma? A lipoma is usually a fatty tumor that is located just below the skin in the neck, and it is usually not serious or harmful. It is also not cancerous, so that is why it is an elective procedure which will be carried out for the patient. So elective procedure means that a patient, the doctor or the surgeon will have a date for the surgery plan, and then the patient will come in usually a day before and they'll get admitted in the hospital, and they will have the whole process for their surgery already pre-planned. So firstly, the post-operative care of the patient will start immediately after the surgery, where the patient will be transported to the post-anesthetic care unit. And here in this unit, the patient is taken there to be checked for the consciousness. If they have not yet regained consciousness, we will come back and check in 15 minutes, or then the patient will have to regain consciousness. Once the patient has regained consciousness, we can start with our first visit, which they will probably receive in the PAU unit. For example, if the surgery had occurred at say 7 a.m. or 8, the patient will probably remain in the PAU for 1 or 2 hours, maybe before the patient is transported into the private ward. So let's begin with what we'll be checking when the patient regains consciousness. So during our first visit, when the patient regains consciousness, we have to check the alertness of the patient. So we can ask them questions such as their name, or if they know where they are, how they are feeling, or if they can hear us, are certain questions that also can be asked to check alertness. Then we will be checking for their vital signs, which includes pulse rate, respiration rate, breathing rate, their blood pressure, temperature, and other vital information which is important. It is also important to remember that for the first 2 to 3 visits, it can be done within every 15 minutes. So if our first visit is normal, then the time of the next visit can be doubled. So for instance, if you come in your first visit and everything is normal, you can come for your second visit in 30 minutes. Next, we can visit them for an hour or so. It is also important to keep an eye on the vital signs changes, such as post-operative shock. It can be indicated from the change in vital sign or bleeding, as well as dehydration or inflammation. And post-operative infection can also occur at times, so it is very important to check their vital signs. In cases of post-operative shock, patients may also become confused and their skin might be clear, so it's important to check for these symptoms as well. And nowadays, with the help of technology, the digital monitors such as ECG can help medical professionals to keep an eye on vital signs regularly and be alerted as soon as these changes occur. When considering the temperature of post-operative patients, 37 degrees might be a little high for normal patients, but in post-operative patients, this is normal and it is part of the recovery process. However, if their temperature elevates to 38 degrees Celsius or 39, then this is something to keep an eye out for, as it must be reported at once, because this may indicate problems such as post-operative infections. Next, you must check for the skin color. So skin color of the patients can be pale, normal, or cyanotic blue. So cyanotic blue skin is an indication of cyanosis or lack of oxygen, and pale skin may be a sign of internal bleedings. So these are the things that we must keep an eye out on for a patient who has just finished surgery. Another important part of post-operative care is checking the site of surgery. So the site of surgery must be checked for hemorrhage, the dressing state, and inflammation. So this includes checking the color or for redness, inflammation, and also the local heat of all these sites that indicate infection. So these are some extra stuff to keep an eye on. Additionally, wound drainage, also urine output should also be checked in most patients of post-operative care. And if they have an IV access, we have to make sure that the IV access is all in correct position and there are no infections. The IV can be removed after a couple of hours. So for instance, if the surgery happened at 7 a.m. in the morning, around 12 p.m. the IV can be removed. That is all for me describing about the post-elective care for lipomas patient surgery. Thank you so much for listening.